The latest figures show nearly 1.5 million people have contracted COVID-19 countrywide, and over 47,000 people have died. Cases have continued to drop, with 2,781 cases reported yesterday. Now, this is compared to over 20,000 a day earlier this year, if you remember that. So for a closer look and a provincial breakdown, Dr. Ridwan Suleiman, CSIR senior researcher, joins me now for this conversation. Doc, thanks a lot for joining us this evening. Is this the time that we can say South Africa is out of the woods, the danger zone, when it comes to daily infections of COVID-19?
Good evening, Faith. No, I wouldn't say that we're out of the woods. I would say, though, that we are past the second wave of COVID-19. And I say that, but let's look firstly at a national level at the number of cases that we're reporting. The 7-day average currently stands at around 2,500 per day. Now that, compared to what we saw at the peak of the second wave, is about 13% of that value. So it's decreased significantly enough and below a threshold to indicate we're now in a post-second wave period. And we now enter a period in which we monitor any resurgence. That being said, at 2,500 cases per day, and probably an underestimate, we're not out of the woods, because the risk of further outbreaks, for super spreading events, and for a resurgence does remain. So we do need to monitor this closely and continue to reduce the transmission opportunities for the virus to mutate. The virus can't mutate if it can't replicate.
Yeah. I mean, Dr. Ridwan, you speak a little bit about how these figures are usually an underestimate of what's currently happening. If you had to give us an estimate of the reality when it comes to COVID-19 daily infections, where are we sitting as a country? The report says about 2,500, but if you have to look at the norm, not the underestimate, but what we're expecting on average, where are we in terms of a ballpark figure?
Look, it's very difficult to quantify the exact figure and the true reflection of the number of cases. We can look at a couple of indicators, though, one being the test positivity measure. That figure has been declining an average over the last. We can also look at some other studies, including seroprevalence studies, which looks at antibodies in people, or immunity. So in other words, looking at how many people have been infected. And some recent studies, although small sample size, indicates that the number of people infected is probably likely 10 times as much as we are reporting. So again, it's a ballpark figure, but gives an indication that the actual reflection is a lot higher than reported.
Yeah. Is there cause for concern on the reported number of COVID-19 related deaths, particularly in the Gauteng province?
Well, the number of deaths has been decreasing nationally and generally over all the provinces. And that trend is expected to continue as it follows the trend in cases. If we look at Gauteng over the last couple of days, last week, the number of reported COVID-19 deaths has increased by 25%. Now, because the number of cases, the test positivity rate, as well as the number of hospitalizations have all been going down. So it's expected that that figure should have been decreasing. The likely explanation is that it's a delay in reporting of deaths that have happened previously.
Yeah. Dr. Ridwan, unfortunately, the signal is not on our side this evening, so we're going to have to leave our conversation there. Dr. Ridwan Suleiman, CSIR senior researcher, giving us the latest when it comes to the number of cases and positivity, as well as the cause for concern, that is the number of COVID-19 related deaths, saying that there's a little bit of underreporting there, or the numbers are coming in late.